Hello everyone and welcome to today's session where we'll be introducing the third unit of our Transformative Oncology part-time online course, Established and Experimental Therapeutics. My name's Hazel and I'm the course advisor for this programme. I'm here to answer any questions that you have about the course, whether you're deciding to apply or after you've applied, whether you're deciding to choose us as your first choice of university. So without further ado, I'm going to hand over to the unit lead, Dr. Jamie Honeychurch, who's going to introduce himself and a bit more about this unit.
Brilliant, thanks a lot, Hazel. So hello everyone and welcome. I'm Jamie Honeychurch and I'm a senior lecturer in cancer immunology based in the Division of Cancer Sciences at the University of Manchester. And I'm particularly interested in understanding how the immune system responds to cancer and how we can target the immune system therapeutically to enhance these responses further. So in my research, we use a variety of preclinical tumour models to evaluate new immunotherapeutic approaches and also try to understand how we can use immunotherapy in combination with other types of treatments such as radiotherapy to generate even better anti-cancer responses. And as well as research, I do a lot of teaching, both within Manchester Medical School. I also supervise students from undergraduate through to PhD level, and I lecture on a number of different master's programmes. And I'm also the unit lead for Unit 3 of the Transformative Oncology course, which is a part-time online learning programme taught by the University of Manchester. And that's what we'll explore in this information video, where I'm going to give you an overview of Unit 3, which focuses on established and experimental therapeutics. So we're going to look at Unit 3 in a bit more detail. I'll talk you through what the unit covers in order to give you an idea of the general content. We'll discuss the sort of skills you can expect to learn and develop. And I'll tell you about what makes this unit unique. And then hopefully that will give you a really good understanding of what's involved in the unit and help you decide whether this unit is something you're interested in and whether it's for you. So the unit will focus on established and experimental therapeutics, and it's divided into 3 separate elements where we'll be looking at the principles of immuno-oncology, the development of targeted therapies, and then more novel approaches to treating cancer, including the repurposing of existing drugs. And I'll also tell you a little bit about the assessment element of the unit. So the Transformative Oncology course consists of 8 individual units, each with their own specific focus, which are shown here. So you can see how the separate units relate to each other, and also the overall makeup of the course. And we're going to focus on and explore Unit 3, which looks at established and experimental therapeutics. And this unit will provide you with an understanding of current treatment strategies that have been translated into clinical practice, as well as more experimental approaches that are currently being developed for future clinical use. And hopefully these will be able to treat or be used to treat every type of cancer and every patient individually. And the unit as a whole is worth 15 credits. So the overall aim of the unit is to provide you with a broad understanding of some of the alternative and newer approaches to treating cancer that have been developed, which are in addition to the more established conventional treatments such as surgery, chemotherapy, and radiotherapy. So we'll look at how these therapies have been developed from preclinical experimental studies right through to clinical trials, and then the use of these treatments for cancer patients. The unit will also cover some of the more novel experimental models and systems that can be used to help develop these therapies. And we'll look at how these new therapeutic approaches can be personalized and used to start to treat every cancer and every patient as an individual. So now we'll look at the individual elements of Unit 3 in a bit more detail and highlight each one in turn. So we'll start with principles of immuno-oncology. This part of the unit will help you to understand the relationship between the immune system, prognosis, and treatment outcome. You'll also learn about the mechanisms underlying an effective anti-cancer immune response and how to improve the efficacy of that response. And you'll also discover ways in which we can use immunotherapy to enhance the immune response to cancer further. And that might involve activating the immune response or overcoming suppression. In the targeted therapy element, you'll evaluate the principles and applications of targeted therapies in the treatment of cancer. We'll explore the essential research which leads to target identification, and you'll also critically review the types of targeted therapy that are in existence at the moment and the steps to identify new candidate patients. And the third element will look at novel treatment approaches and drug repurposing. And here you'll gain some insight into cell and gene therapy and novel model systems that can be used to guide the development of new treatments. We'll consider how existing drugs might be repurposed for the effective treatment of cancer. And then we'll follow some case studies where clinical observations have led to effective new treatment strategies. So in terms of the structure of Unit 3 and how it's delivered, Unit 3 is divided into 3 5-credit elements, which will be delivered over 8 weeks. So we have the principles of immuno-oncology, targeted therapy, and the novel approaches, including drug repurposing. And each of these 3 separate elements will be delivered over a 2-week period. They'll be delivered online, and there'll also be plenty of opportunities to interact with your peers and academic staff, including myself, through the use of online discussion boards as you work through each of those elements. And at the end, the final 2 weeks of the unit are allocated to assessments, and I'll go through what this involves a little later on. So if we consider the learning objectives for this unit, firstly, the knowledge and understanding that you'll gain, then by the end of the unit, you'll be able to explain the relationship between the immune system and prognosis. You'll understand how immunotherapy can be used to enhance anti-cancer immune responses. You'll be able to outline the principles of targeted therapy, and you'll understand how emerging therapies and model systems can be used to enhance cancer control. In the second unit, in terms of intellectual skills, you'll be able to demonstrate reasoned arguments for the development of novel therapies. You'll critically appraise the challenges presented by immunotherapy. You'll be able to demonstrate efficient and effective problem solving regarding treatment selection based on clinical evidence, and you'll be able to appraise current strategies for tumor-specific therapies. The practical skills that you can expect to develop during this unit are to plan and execute guided and independent research. You'll be able to audit correct thinking in the development of new anti-cancer treatments. You'll be able to retrieve relevant information from a variety of sources, including libraries, electronic and online data. And you'll be able to report findings in a concise and structured manner. And finally, you'll also develop transferable skills and personal qualities, including being able to present findings in a clear and concise way using appropriate media, constructively deliver feedback to peers, demonstrate independent thinking and evidence integrating to formulate hypotheses, and manage your time and show evidence of scheduling tasks in order of importance. So for the assessment, there is a 2-week block at the end of the unit, which is dedicated time for you to complete some aspects of assessment, but we'll also be carrying out other aspects of the assessment throughout the entire unit. So the assessments are divided into 3 types. Firstly, there'll be multiple choice questions, which will be available online and fully automated, so you can work your way through them in your own time. And these will assess both the breadth and depth of your knowledge that you've gained throughout the unit, and also your comprehension, so your understanding of the concepts that you will learn about. The second area of assessment is based on reflective practice, which you can demonstrate throughout the 2-week blocks for each individual element by contributing to online discussion boards. Here you can share and discuss your ideas and your learning through written summaries or podcasts or videos, however you wish to interact. And this will encourage peer-to-peer learning and interaction. And you'll also build a personal reflective portfolio using PebblePad, which is a personal learning platform, which you can use to evidence all of the skills, including transferable skills, that you have developed during the unit. And this will help promote lifelong learning beyond the programme. And finally, you'll be required to submit a comprehension assignment, which will draw on all of your learning from this unit and demonstrate your ability to apply that knowledge. And this assignment can be submitted in a variety of different ways, whichever you feel suits you best. So it can be a written assignment or an oral presentation, or even an audio presentation such as a podcast. So there are plenty of options depending on your own specific preference. So I hope that's been useful in providing an overview of Unit 3. I hope you found it interesting, and I'm going to hand you back to Hazel. Thanks.
That's brilliant. Thanks very much, Jamie, and thanks for providing that overview as well. Hopefully it's given people a bit more of an insight into the unit and the different areas that, that you're going to be covering. So as we know, the Transformative Oncology part-time online course is a new programme for September 2022. So you've not had a chance to teach this unit just yet. I was just wondering, as you were going through that, and before we kind of close off for today, as you've been building the unit, which part are you most looking forward to delivering?
Oh, that's a great question, Hazel. So obviously, with my research interests in cancer immunology and immunotherapy, I'm really looking forward to the element on the principles of immuno-oncology. And this is going to cover some of the important concepts that underpin the use of immunotherapy, but also look at cutting-edge experimental studies and clinical data, which will demonstrate both the power of immunotherapy and also some of the current limitations. And obviously, this is a really exciting field at the moment. It was designated Breakthrough of the Year back in 2013 in Science. It's revolutionized the way in which cancer patients are treated with the development of immune checkpoint inhibitors, which you'll learn about, by the way, on the course. And it's also led to 2 Nobel Prizes for Medicine in 2018 for James Allison and Tasuku Honjo for their work on immune checkpoints. So, it's a really great time to be involved in the work. But having said that, probably the part I'm actually looking most forward to is the third element, which is the novel approaches. So these will bring in some more immune-related treatments that are being developed in Manchester that are currently being tested in clinical trials. So given the clinical impact of immune oncology over the last decade, scientists working on multiple different aspects of cancer are now considering the impact of the immune system on their work. And so this is opening up whole new areas of biology, some really fantastic discovery science, which we'll provide a taster of on the course. So I think that's going to be really exciting to share.
Yeah, no, you're absolutely right. And I think that just really highlights as well just how current this course is and just how recent some of these breakthroughs and some of the data that you're going to be using, as well as for the students studying, how recently that's kind of been collected and how much it can really benefit and impact it quickly, I guess is what I'm trying to say. Yeah. And so that kind of brings to a close our summary and our introduction to Unit 3 of the Transformative Oncology course. So if you've been inspired by what you've listened to today, you've got any further questions either about this unit or about the course more broadly, or you'd like to discuss your eligibility for the programme or how to apply, then I'm here for you to get in contact with me. You can see my email address on screen, studyonline@manchester.ac.uk, and you can also contact me by phone, either by WhatsApp or by giving me a call or sending a text, and my number's on screen for you there as well. So that really brings us to a close of today's session. I just want to say thank you, Jamie, for taking the time to explain a bit more about your unit, and I'm sure that we're all really looking forward to it running and starting in the next few months. So thanks very much.
Thanks.